Thank God it's Friday. Hey there, Escalorians! What's up? Pam here, and this is CEU Friday Features.
Universidad Centro.
CEU ka na, CEU ako.
Hi, hello! I'm back, guys. I hope all is well with you and that you missed me somehow. So, for tonight's episode, I will be with a junior doctor to talk about some of her medical confessions. Ooh. But as always, before we proceed, make sure to like, share, subscribe, and hit that notification bell. Our featured Escolarian is part of the Pioneer Batch class of 2020 from CEU School of Medicine, and she is currently a primary care physician in a community-based clinic. Escolarians, here we have Dr. Judy Anne Eclarino. Hi, Doc.
Hi, Pam.
Ayan. Please say hi to our Escolarian viewers po, Doc.
Hello sa mga kapwa ko Escolarians. I am Dr. Judy Anne Eclarino from the Pioneer Batch of CEU School of Medicine.
Yes, ayan, palakpakan po para kay Dr. Judy. Hello po, Doc. It's so nice to see you today. How are you feeling so far?
So far, we're good. Medyo kinakabahan po, pero fine.
Yes, mag-enjoy lang po tayo, Doc, today dahil marami tayong malalaman ng mga bagay mula sa inyong experience at inyong storya. Kaya, let's go, Doc! Ready na po ba kayo for today's video?
Yes!
Ayan, ready na si Doc. So, now you're a doctor already after years of hard work in med school. And for all of us here who are really interested about med school in general, and of course, your story to tell, let's make this conversation fun and intriguing by playing I Confess That. So, it's confession time, Dr. Judy. What's your first confession for us?
I confess that two important persons in my life made this special request for me to pursue medicine. My dad and my grandfather, Tatay Loloy. Way back, our family went through a lot. My dad was diagnosed with liver cancer, but I had to tell him that his health is our utmost priority. And may studies can come after. So, but unfortunately, my dad died without seeing me graduate from college. And the other one is my Tatay Loloy. So, he is my paternal grandfather. He told me, gusto kong magkaroon ng apo na doktor. Kahit magsanga tayo ng lupa para sa pag-aaral mo. So, actually, it was his dream for my dad, but my dad was not able to fulfill it. That's why I became next in line to complete the mission. So, his statement was so firm and so sincere, and it served as my inspiration whenever I felt like giving up.
Thank you so much po for sharing that story. It really means a lot, and it's so nice to hear it po right from the start pa lang. And grabe, I'm really touched po, and I hope you're doing great, and I know everyone is proud of you now that you're a doctor. How did you realize, or what really pushed you to think na this is my dream? My dream is to be a doctor. Like, ano po yung moment na nagsabi sa'yo na ito talaga yung pangarap ko?
Maybe because I felt that our country needs more doctors. Actually, di ba, meron kasing mga lugar dito sa atin, sa Philippines, na merong namamatay, hindi nakita ng doktor, or even a nurse, or even mga barangay health.
That's true po.
Professionals, parang ganun. So, kaya yun siguro yung isa sa advocacy ko to make health more accessible to others po. Even yung walang pambayad.
And And that's such a great initiative po and advocacy to really push on. At yun talaga yung kailangan nating lahat dito. Kaya maraming salamat po ulit, Doc. Napaka-husay niyo po at napaka-pure ng intentions niyo po for being a doctor. With regards po with your experiences in nutrition and dietetics po, why did you decide to take on this course po in the first place?
Actually, my mom is an escolarian. She's a graduate of CEU Nutrition also. And she's my inspiration to pursue that course. And from her, I learned how helpful it is for patients. Because as we all know, usually the root cause is bad eating habits, ganyan. So, and also, very holistic kasi nung nutrition. So, you can also work in different industries aside from clinical nutrition. So, and then, I believe it's a very good pre-med course also. When you provide intervention to patients, you also advise them how to modify their lifestyle.
Yes, exactly po. And I'm sure a lot of people here, especially in the Philippines, need to be educated more on how to take care of themselves po. So that instead of really curing it, parang piniprevent na natin muna yung ibang diseases if we have proper nutrition. Now, I will go back po to your family naman. Since they were your primary inspiration, your grandfather and your father were your primary motivation to pursue medicine. So, how did your family took your decision po? Especially knowing that med school is expensive, how did you and your family prepare for it?
Actually, yung nagbabayad talaga ng expenses ko was my sister.
Oh.
Yes, she's an OFW nurse. So she had to sacrifice her earnings for me, and I am very thankful for that. And sobrang thankful din ako, sobrang bait-bait po ng mga kaklase ko and mga professors. So,
yes, true po yan. Ang dami po talagang yung environment din po mismo sa CEU. It's very friendly and accommodating. And pero Doc, yung scholarship naman, it's all in your effort then to really help your sister. So, nasa a huge part of your success is really based on you then.
Saka si God talaga.
Yes po, always. Now, let's hear about your med school experiences. Ayan. So, it's confession time again, Dr. Judy. What's your next confession to make?
I confess that I will never forget the first lecture that I attended in med school. Kasi feeling ko parang sasabog na yung utak ko. Sabi.
Grabe po. Can you please share that to us po?
Actually, it was for biochemistry. And I confess that it is one of the most difficult subject for me. And yun nga, as I have mentioned, parang sasabog yung utak ko kasi though the topics that were discussed, feeling ko parang one semester na siya for my pre-med. Tapos parang feeling ko for 4 hours lang siyang diniscuss. So sabi ko, wow, so this is med school. Parang ganun yung feeling. And then parang, and marami pang moments na ganun yung feeling ko na parang, oh, ang sakit sa ulo. Pero still, you have to push through and continue.
Yes. And you did po. So, great job po for that, Dr. Judy. I'm just curious, no? Madami po sa TikTok nagtatanong, for example, what's the most difficult subject in med school?
Actually, it would also depend on your pre-med. Kasi like with my classmates who are medtechs, so yung other subjects would be easier for them, like yung pathology, ganyan. Pero for me, of course, since my course is a bit different po, nutrition. So, parang yung pathology, sobrang, ang hirap din niya. Pero siguro you have to find your way para lang din to survive. You really need to have a good support system. So from the people around you, like your friends, so you can ask help from your classmates, ganyan, from your professors.
Yes, agree po. Always a solid and great support system will really help us through the tough times in school. So that's great po that you have yours naman. So, Dr. Judy, ngayon naman po, what are some of your expectations about med school that turn out to be true and some maybe not? Yung iba, hindi pala ganito.
Actually, before I entered med school, I already conditioned myself that it would be very different. So, from college. But, hindi ko lang ina-expect that I would be reading 30 to 50 pages per night, especially for exam. So, parang, I don't know how I was able to absorb the information. I think it's not only about understanding the theories po, but also you have to learn how to apply it to your patient. So it's not enough that you are able to finish the book, but also you know how to collate all the information, how to discern which information is applicable to your patient.
Yes. And may I know, Doc, I'm very curious since madami kayong inaaral, ang daming readings, at hindi lang puro theories, kailangan mo pa i-apply. So, what's your study habit? What's your best study habit that maybe you can share to our fellow med school students as of the moment?
I like those with the graphics or the illustrations. So I think that's one thing to do is to find the channels, YouTube channels that would also make you understand the topics well. Kasi if you would just focus on the book, minsan sobrang dami na ng information. Parang it's really hard to absorb.
Now naman po, can you take us back to the moment when you learned that you passed the licensure exam? Ano po yung naramdaman nyo? How did you celebrate and all?
That moment was parang hindi talaga ako makapaniwala. I was with my mom and I told her, "Ma, pasado na po ako." Then I am the first doctor of my immediate family. So parang sobrang hindi kami makapaniwala. Nagkakaroon ng doctor sa family. So nung nalaman namin that I passed the board, parang everybody is celebrating talaga.
That's so inspiring and beautiful po. Thank you for sharing your story. And I'm sure it was all worth it. Lahat ng paghihirap, lahat ng mga araw na hindi matapos yung reading. I'm sure lahat bumuhos nung panahon na yan. And that's so beautiful indeed, Doc. Thank you so much. Of course, we will not end this episode without talking about your life now as a doctor. Ngayong doktor ka na po. Papag-usapan naman natin yung buhay mo po ngayon. You know this already, Dr. Judy. What do you want to confess this time?
I would want to confess that being a doctor is not all glamorous. You will be able to serve patients of all walks of life. There will be patients that are not capable of paying you. So sometimes yung ibang patients parang they would be very sorry kasi Doc, kulang po yung pera ko, ganyan. Even on the poorest areas of the country, yung iba they would give, like for example, yung na-harvest lang nila ng mga prutas, ganyan. It would not be financially rewarding for some of the doctors. Pero as long as you are able to serve, it doesn't matter how much they will pay. Kasi it's a passion to become a doctor. So parang as long as you see them, that you were able to alleviate their sufferings, I think it is good enough. than to be financially rewarded.
Wow. Grabe, Doc. Thank you so much for that. And it's really indeed beautiful to see that you are helping others. Kahit walang rewards pa yun, it's all the reward that you need, not just financially. Kahit po sa puso nyo, sa passion mo. Thank you so much for that, Doc. Now po, as a doctor, what are the struggles that you have to endure?
I confess that I sometimes think twice if I made the right decision to become a doctor, because especially now that we are in a pandemic,
Yeah.
and we have seen a lot of fallen heroes, our colleagues who died because of this pandemic. So I think we still need to improve our healthcare system. We still need to provide better benefits for our healthcare workers, and we still need to provide more facilities and more services to the people.
Yes, indeed, Doc. I agree. Talaga po. And in your perspective, on what aspects can we immediately improve on as of the moment? Yung mga bagay na pwede na nating maayos, pero baka hindi pa natin nabibigyang pansin.
Okay. So, I think yung accessibility ng healthcare dun sa mga tao. Currently, there are programs na they provide teleconsultations to the people, which I am one of the volunteers for that. And I am really proud on that advocacy. Because especially yung mga wala talagang pambayad sa doktor. So, napakalaking tulong po nun sa mga pasyente. Kasi yung pambayad mo na for consult, pwede mo na kasi siyang pambili ng gamot or pangkain, di ba? So, I think if more doctors would be willing to serve others, even just for teleconsultation, or I think maybe if the government can design a program wherein more patients would have access to doctors for their health concerns.
Yes, indeed, Doc. And I agree po. And teleconsultation, especially in this time of pandemic, really help na rin po to reach out to others and to help them and educate them on how to manage their health crisis or issues po. So that's great po, Doc. Maraming salamat po doon. Of course, thank you so much, Dr. Judy, once again, for being such a sport, sharing with us those fun, intriguing, and inspiring confessions indeed. I truly enjoyed this episode, and that's all thanks to you po. I really learned that the most rewarding thing in life is serving the people and helping others to continue a better life. In this way, we are fulfilled as well. It's the best thing that we can have, and I think a lot of Escolarians here watching us were inspired to know that there's more than just science and medicine. There's beyond connecting with other people and really helping them live better. Now, Doc Judy, before I say goodbye though, I just want to ask if you have any advice to our Escolarians who also want to become a doctor like you, an inspiring doctor like you. Maybe you have a confession to make about this on how to know if med school is really for you.
So, as I have mentioned a while ago, I confess that medicine and being a doctor is not all glamorous. So, if you are entering medicine just because you think you are smart or somebody pushes you to do it, then maybe you have to reevaluate your decision. Because being a doctor is not just about money or prestige, because you have to sacrifice a lot of things. As I have mentioned, it's your time, your finances, your effort.
Yes, there you have it from Dr. Judy. Look beyond the glitz and glamour of being a doctor because sacrifice is indeed part of this noble service that is part of being a doctor. Yan. Maraming salamat po, Dr. Judy. Thank you so much for spending this wonderful time with us. Please stay safe and healthy always. Goodbye po, Dr. Judy.
Bye. Thank
Thank you so much po. And that's a wrap. Do you have someone in mind that you want to be featured in our show? You can comment their name and what topic you want us to discuss with them, and we'll surely get on that. Also, don't forget to follow our podcast. That's Escolarian Podcast on Spotify. See you in our next episode, Escolarians. Again, Pam here, and this is CEU Friday Features.